In this video, I would like to go over the lesions of a long thoracic nerve, musculocutaneous nerve, as well as an axillary nerve. So in a separate video, I've discussed the median nerve, ulnar nerve, as well as radial nerve injuries. So here I'd like to focus on these three nerves and then also discuss the Erb's palsy, which is from damage to the C5 and the C6 roots, as well as the Klumpke's palsy, which is due to the damage to the C8 and T1. So first, I'd like to start with a long thoracic nerve, which is innervating the serratus anterior. So here is an example of a serratus anterior muscle, the function of which is protraction and rotation of the scapula. And a common procedure that can cause damage to the long thoracic nerve is mastectomy. And so after that, there would be paralysis of a serratus anterior, and these patients will present with a winged scapula. The next lesion is the musculocutaneous nerve, which is innervating the coracobrachialis, biceps brachialis, as well as the brachialis muscles. So the function of a coracobrachialis as well as biceps brachialis is arm flexor, and then biceps brachialis as well as brachialis also do the forearm flexing. So the lesion of musculocutaneous nerve will cause weakness of arm and forearm flexing. And then the next lesion is the lesion of an axillary nerve. So in this image, you can see that the axillary nerve has wrapped around the humerus. So conditions that cause surgical neck fracture of a humerus or cause dislocation of the humerus can cause damage to the axillary nerve. And the function of axillary nerve is to innervate the deltoid muscle as well as the teres minor. So since the function of a deltoid muscle is to help with the abduction of arm at the shoulder, patients that have lesion of the axillary nerve will have problem with abduction at the shoulder. And then the final two lesions are Erb's and Klumpke's palsy. So Erb's palsy is caused by the lesion of a C5, C6 in the upper roots of a brachial plexus, and upper roots are usually damaged when there is too much angle between the neck and the shoulder. So for instance, when a child is being born, if they grab onto the head and pull that out, so the angle between the neck and the shoulder increases, therefore there would be a damage of the upper roots and cause Erb's palsy. And then another example that can cause Erb's palsy is, for instance, if a patient falls on the neck on a floor, and if lucky and not break the neck, then there is a high risk of developing Erb's palsy from damage to C5 and C6 nerve roots. The next condition is the Klumpke's palsy, which is from damage to C8 and T1 nerve roots. And this condition is seen when there is a sudden increase in the angle between the arm and the chest. So for instance, let's say that there is someone that is falling, and before falling they grab onto an object. Let's say there's a tree here and they grab onto a branch of a tree. There's a sudden increase in the angle between the arm and the chest, which will damage the C8 and T1 nerve roots. On the other hand, when the child is being born, if they try to grab onto the arm and pull it out, then that's another time that lower nerve roots can get damaged and cause Klumpke's palsy. So here I'd like to go over the features of these palsies. So with the Erb's palsy, which is due to the damage from C5 to C6 nerve roots, these patients present with the internal rotation of the arm, pronated forearm, as well as a hanged limb. And then here I've provided you an image, and the other name for Erb's palsy is waiter's tip. And then the final condition is Klumpke's palsy, which is from the damage to C8 to T1 nerve roots, which could be either, like for instance, from forceful and upward pulling of a child's arm or grabbing onto an object while falling. And alternatively, it could also be caused from thoracic outlet syndrome, where there is compression of a subclavian artery as well as inferior trunks of the brachial plexus. And so the presentation of Klumpke's palsies is total claw hand. due to the paralysis of the lumbrical muscles. And then you should also know that since the T1 is affected in these patients, they could also develop the Horner's syndrome. So they can present with the total claw hand as well as with meiosis, which is the same as the constriction of the pupils, as well as ptosis of the eyelid. And that concludes our discussion.